Hey everyone! Today I have some exciting news in the fight against one of the deadliest cancers, pancreatic cancer. Specifically, pancreatic ductal adenocarcinoma, or PDAC, which makes up over 90% of pancreatic cancers. This type of cancer has been very difficult to treat with current therapies and immunotherapies. But there's hope. In a recent phase I trial published in Nature, researchers have developed a game-changing personalized RNA neoantigen vaccine called autogene cevumeran. This vaccine has shown promising results, creating long-lasting immune responses in patients and delaying the return of cancer. Let's explore what makes this vaccine so special. So what exactly is the problem with pancreatic cancer? PDAC is aggressive and has a low mutational burden, meaning there are fewer things for therapies to target. Most patients see their cancer return within a year after surgery, and the 5-year survival rate is sadly only 12%. Developing effective vaccines has been a real challenge, until now. How does autogene cevumeran work? It's a personalized vaccine that targets neoantigens, which are proteins created by mutations in a patient's tumor. Using mRNA lipoplex nanoparticles, the vaccine delivers up to 20 neoantigens to teach the immune system to recognize and attack cancer cells. In the trial, patients received this vaccine along with chemotherapy and a single dose of the PD-L1 inhibitor, atezolizumab, to boost immune activation. The main findings are amazing. First, long-lasting T-cell responses were seen. In 8 out of 16 vaccinated patients, the vaccine created a large number of CD8+ T-cells that targeted tumor neoantigens. These T-cells had an estimated average lifespan of 7.7 years after the booster shot, with some lasting for decades, much longer than the typical 3-year window for PDAC recurrence. Impressively, 86% of T-cell clones were still detectable in the blood 3 years after vaccination, and they still had strong anti-cancer abilities. Second, the vaccine delayed the cancer's return. Patients who responded to the vaccine had a median recurrence-free survival that was not reached at 3.2 years of follow-up, compared to 13.4 months in those who didn't respond. 2 patients whose cancer came back later had fewer vaccine-induced T-cells, suggesting a direct connection between T-cell persistence and controlling the cancer. Third, the way the vaccine works is really interesting. It creates brand new T-cells, not using pre-existing ones, that act like tissue-resident memory cells, allowing for long-term monitoring. These cells show markers linked to cytotoxic function and staying in the tissue. Single-cell RNA sequencing showed that T-cells change from a growing state during vaccination to a stable, effector-rich memory phase, staying functional even after chemotherapy. Finally, the vaccine affects how the tumor changes over time. In tumors that came back, the clones targeted by the vaccine were specifically eliminated, showing immune pressure. However, tumors developed new mutations, highlighting the need for vaccine strategies that can adapt. Why is this important? Overcoming the low mutational burden in PDAC is a big step forward. This vaccine has shown that even rare neoantigens can create a strong, long-lasting immune response. The safety and ability to easily produce the mRNA platform are also promising, avoiding the risks of genetic integration seen with viral vectors. This combination of neoantigen vaccines with chemotherapy and checkpoint inhibitors could change how we think about adjuvant therapy for cancers that are hard to treat with immunotherapy. What's next? While these results are exciting, the small size of the trial means we need to confirm them in larger studies. A global phase 3 trial is happening now to confirm these findings. Future research might look at regular booster shots or redesigned vaccines that target new mutations. Dr. Vinod Balachandran, the lead author and a surgeon scientist at Memorial Sloan Kettering, says, "This study shows that personalized vaccines can retrain the immune system to fight pancreatic cancer over the long term. The fact that these T-cells last so long, potentially longer than the patient, suggests we're entering a new age in cancer immunotherapy." To wrap up, autogene cevumeran is a major advancement in cancer treatment, offering hope for PDAC patients and a model for treating other cancers with low mutations. By using the immune system's memory, this approach could change the fight against one of medicine's toughest enemies. For more information, read the full paper in Nature. Thanks for watching.